Just reporting our experience during the pandemic. Again, we put together a total of 28 patients, including allogenic stem cell transplants. I think 15 of those and 12 autologous, and at least one CAR T-cell therapy patient who were diagnosed with SARS-CoV-2 infection after the transplant. Most of them were presenting a couple of years out of these T-cell therapies, and they were followed for an average of 2 months. And what we observed, as I was telling you, is high mortality. Roughly a quarter of these patients required admission to the intensive care unit and mechanical ventilation for severe COVID-19. They received various therapies targeting COVID-19, but the outcomes were, as I said, were actually poor compared to the age-matched US population. We also observed that these patients tend to remain PCR positive for very prolonged periods of time, which is something that has been observed in many cohorts. They shed SARS-CoV-2 for an average of 30 days or more. So, and what's more concerning is there is some new data that has been published showing that this PCR positivity actually correlates with viable virus that you can grow in vitro and therefore is still able to be transmitted to others or cause active disease. Another observation we made is that roughly a third of the patients who had symptoms of COVID-19 might have an initially falsely negative PCR testing, but you can use chest imaging to kind of support the diagnosis of COVID. We observed a discordancy between abnormal chest X-rays and negative PCRs at first, but eventually those patients, once the viral load is enough to be detected by the test, then they become positive. So diagnosis is not easy either, so you have to have a high index of clinical suspicion. In terms of laboratory findings, these patients had, many of them had lymphopenia or elevated inflammatory markers, which is very common with COVID-19. So that was very similar to non-immunocompromised cohorts. But I think the main finding, as I said, is, again, like 25-30% of them require ICU admission, and roughly a quarter of them will also have a mortality event within 30 days of admission. So very poor outcomes.